Welcome to another episode of the Listen and Learn series. In this episode, we're specifically going to talk about healthcare and how it adversely impacts African American and minority communities. In talking about that healthcare, I want to start with a historical perspective, starting with the well-known physician J. Marion Sims. J. Marian Sims was a famous physician from the late 1800s, and his claim to fame was his creation of the vaginal speculum and the fistula surgical repair procedure. So let me tell you a little bit about who this J. Marion Sims is. He was controversial because it was known that he used female slaves as his subjects, and that's how he perfected his craft. He was known to operate on these black female slaves without anesthesia, even after the creation of the anesthesia. He has been known as the father of gynecology, and to be very specific, he had a statue that was placed in the New York Central Park right across from the Academy of Medicine in New York, and it was there until 2018 when it was removed. It was around the same time that there was a lot of uprise and discussion about controversial Confederate monuments, and as a result, his monument ended up being removed. Another well-known example that many people think of when we think about healthcare and disparities in African American communities is the Tuskegee Experiment. The Tuskegee Syphilis Experiment was an experiment that took place for over 40 years between 1932 and 1972, where essentially you had poor black sharecroppers in Alabama who were used for this experiment. In return, they were promised medical care and food, but they were unaware, in fact, that they were a part of a study. There was no informed consent for them at this time. So when I think about the Tuskegee Experiment, there are so many issues that come up for me. I teach ethics classes, and I think that this is a massive ethical issue. It's hard for me to understand how this experiment could have gone on for 40 years before someone actually blew the whistle on the unethical processes that led to this Tuskegee experiment. This led me to ask a medical doctor who I know, what was the mention of J. Marion Sims or the Tuskegee experiment for him in medical school. I said, did you take a medical history class or some kind of medical ethics class? And if so, did these issues come up? And this doctor said to me in a surprising no, we did not. I know I'm aware of these issues, but these are not things that we discuss in medical school. I then asked a pharmacist who I know, I said, did you talk about J. Marion Sims or the Tuskegee Experiment in pharmacy school in your studies? Did you talk about medical ethics and how certain issues impact minority or disadvantaged communities? And her response to me was, no, the only ethics class that we were required to take was a part of our general ed, not our pharmacy degree. So that in itself is shocking to me. The pharmacist said to me that the only thing that she can think about or recall from her ethics discussions was discussions about euthanasia. I teach ethics, business, and leadership classes. In our business classes, we look at ethics from a business lens. In the leadership classes, we look at ethics from a leadership lens. And it's hard for me to digest the thought of the medical field not looking at ethics from the medical lens. So I encourage you to continue to do your research. So let's get back to Tuskegee. Many of those used in the Tuskegee experiment not only did not know that they had syphilis, but they also were not treated for their syphilis, despite the well-known penicillin cure for syphilis at this time. So as such, we have these spouses, kids, family members, and whoever else possibly exposed to the syphilis for these unknown subjects. So essentially, those with syphilis were not given the penicillin because also they ended up dying, and when they died, their bodies were used for science. So while this experiment was taking place, many people knew about this experiment, but no one spoke up. It was 40 years before someone actually blew the whistle or shed light on this Tuskegee experiment by publishing an article about it. Not too far after that, the NAACP filed a lawsuit, and the federal government essentially settled this lawsuit for a mere $10 million. This is only the tip of the iceberg. Prejudices and stereotypes suggest that African American women are able to bear the burden of pain at a larger rate and typically aren't given pain medication, and if they are, it's at different levels that they're getting it. During slavery, as well as we're talking about the historical perspective, it was common for Black women to be pushed to have kids. Slaves were bread, essentially, because at the end of the day, if you are a resource for me, I want more of you. If you're going to have babies and I can sell your baby for profit, it is a beneficial thing for you to have a baby. President Thomas Jefferson said it best. I'm summarizing his words, but he essentially said that a black African slave woman who can have a baby every 2 years is more valuable than any male slave could ever be. And that is because if every 2 years she's having a baby, every 2 years that is another worker on their plantation or another source of revenue once they're able to sell that slave baby. So once slavery ended, there was not the same value to black people. I am no longer able to benefit from you doing free labor, or I'm not able to benefit from the sale of your newborn baby. So then came population control. There, all of a sudden, once slaves were free, became a control over population and the fact that minorities, including black communities, were producing at an alarming rate. So when we talk about population control, the discussion leads you to Margaret Sanger, who was the founder of the now known Planned Parenthood and the controversial Negro Project that they did. So essentially, the Negro Project was an initiative to provide Black women in the South and their families access to birth control and other forms of contraceptives. So those are three things that naturally come up when you're talking about racial disparities in minority communities. First, the history of how J. Marion Sims used slaves without anesthesia as subjects for perfecting his craft and experiments. How the United States government used the Tuskegee Experiment for 40 years. And the Negro Project itself and the idea of preventing population growth in African American communities. There are other issues, specifically as we talk about healthcare and disparities. And one of the very issues in itself arose when looking at the textbook and biases that come up in examples of how Black people tolerate pain at a different level or how they should be treated. The very same textbooks used to educate our medical professionals. You get a whole lot of Black people who will say that they're not comfortable going to their medical professionals because they do not feel that they're going to get the same level of treatment. They do not have the same level of trust with the medical professionals. They feel that they're going to get a lower level of care. And by the way, these are a lot of things that have been studied and proven in research. As we talked about gynecology, there are some statistics that talk about how Black women are 3 or 4 times more likely to die during birth, pregnancy, and childbirth. This is another issue that is a big deal. And in a previous video, I talked about redlining. Redlining is one thing that in itself limited African Americans to access to quality health care or access to the very same hospitals. When we talk about segregation, segregation was a time where African Americans did not have this very same access to hospitals and care. And these are things that we see continue to persist even in 2020. There are studies that show that African Americans, even who have the same level of education, success, and health care, same health insurance, do not get the same level of access to doctors and health care as our white or majority counterparts. One study found that racial and ethnic minorities receive lower quality health care than white people, even when insurance status, income, age, and severity of conditions are comparable amongst those groups. So overall, lower quality of health care was defined by this same study as concrete inferior care that physicians give to their Black patients. I think about how these issues impact African American communities and how oftentimes there are diseases or conditions known to be more prevalent in the Black community. And what happens was with those conditions and issues is they do not get the same level of research or attention. I think about sickle cell anemia and how that is well known to be considered a Black disease, but there's not the same level of study or medical research and study that goes into sickle cell studying as would be an issue that is known to be a white issue. It's not just the sickle cell disease, it's other things such as hypertension, diabetes, or other things that are known to be attributed heavily to the African American community. Studies show that they're not given the same level of attention in medical research and support. I encourage you to further explore some of these topics. You would be mind blown by some of the history out there and some of the studies that confirm the racial inequities that continue to persist for African American communities. Right at this very moment, there have been examples of racial disparities that exist with the COVID-19 pandemic. In a May 2020 Yale report, Researchers found that Black Americans are 3.5 times more likely to die of COVID-19 than white Americans. This same study found that Latinx people are almost twice as likely to die of this disease as well as compared to white people. We could also look at more recent history. About 20 years ago, in another publication, specifically the Institute of Medicine's Unequal Treatment Report, this study ultimately found that U.S. racial and ethnic minorities are less likely to receive preventive medical treatments as compared to whites, and they often receive a lower quality of healthcare. So you see, implicit biases also exist in healthcare. Another study said in order to reduce racial and ethnic healthcare disparities, healthcare professionals must explicitly acknowledge that race and racism factor into healthcare. So you see, there is work to be done, and I am so happy that we are educating ourselves about some of these ways that implicit bias shows up in the healthcare area. As a reminder, this series is designed to educate and shed light on issues where racism impacts our systems and institutions, often in subliminal ways. So let's keep learning together. As always, I thank you for watching. If you have not already done so, I encourage you to subscribe to my YouTube channel and hit the notification bell so you are made aware of when I post the next videos. Until then, keep being bold, keep learning. Thank you and have a great day.